Hidden beneath smiles, concealed by laughter, depression lingers. It's more than a mere sadness. It's an intricate, deep-rooted condition that affects millions. Today, we pull back the curtain on depression, delving into its symptoms, causes, and treatments. Welcome to our exploration of one of the most prevalent, yet misunderstood mental health conditions, depression. This episode aims to deepen our understanding of depression, its symptoms, causes, and the various treatments available. Depression, also known as major depressive disorder, is more than just a bout of the blues. It's a complex condition that involves persistent feelings of sadness, hopelessness, and a loss of interest in previously enjoyed activities. It's not a sign of weakness or a character flaw. It's a real and serious medical illness with tangible effects on both mental and physical health. Depression is a pervasive problem, affecting millions of people worldwide and impacting their ability to function in their everyday lives. But it's often misunderstood, which can make the journey to recovery more challenging for those who are affected. The symptoms of depression go beyond the emotional. They impact everything from our feelings and thoughts to our physical well-being. Here are some of the symptoms commonly associated with depression. A persistent feeling of sadness, anxiety, or emptiness is often the hallmark of depression. It's not just an occasional feeling of being down, but a constant companion that can make everything from getting out of bed to interacting with loved ones feel like an insurmountable challenge. Depression can also lead to a loss of interest or pleasure in activities once enjoyed. This could include hobbies, social activities, or even sex. The world may seem colorless, and previously enjoyable experiences may seem devoid of joy. A significant increase or decrease in appetite and weight changes can be another symptom of depression. Some people may find themselves eating more as a form of comfort, while others might lose all interest in food. Sleep disturbances, such as insomnia or oversleeping, can also occur. Persistent fatigue or loss of energy is another symptom, with individuals feeling physically drained and constantly tired. Depression can also be accompanied by feelings of worthlessness or excessive guilt. People might blame themselves for things that are not their fault or view minor mistakes as major failures. Difficulty thinking, concentrating, or making decisions can be an additional symptom. It may become a struggle to focus on work or even simple tasks, leading to procrastination and indecisiveness. And in severe cases, recurring thoughts of death or suicide can be present. This symptom is a serious red flag and requires immediate attention from a mental health professional. It's important to remember that the severity, frequency, and duration of symptoms can vary depending on the individual and their particular form of depression. Depression doesn't have a single known cause. Instead, it's likely the result of a combination of genetic, biochemical, environmental, and psychological factors. Some people are genetically predisposed to depression, with it occurring more frequently in people whose blood relatives also have the condition. Biochemical factors involve changes in the brain's chemical balance, with neurotransmitters playing a crucial role. Environmental factors such as continuous exposure to violence, neglect, abuse, or poverty can make some people more susceptible to depression. Significant life events, such as the death of a loved one, a divorce, or a job loss, can also contribute to the onset of depression. Depression can also co-occur with other serious medical illnesses, such as diabetes, cancer, heart disease, and Parkinson's disease, often exacerbating the symptoms of these illnesses. Though depression can be debilitating, The good news is that it's treatable, and the vast majority of people with depressive disorders improve when they receive appropriate treatment. Let's explore the most common forms of treatment for depression. Psychotherapy, also known as talking therapy, is often a very effective treatment for depression. During psychotherapy, a person talks to a licensed and trained mental health care professional who helps them identify and work through the factors that may be causing their depression. Cognitive behavioral therapy, CBT, is one type of psychotherapy used to treat depression. It helps people understand and change thought patterns that lead to harmful feelings or actions. Interpersonal therapy, IPT, on the other hand, focuses on improving problems in personal relationships and other changes in life that may be contributing to depression. Antidepressants are medicines that treat depression. They work to balance chemicals in the brain that affect mood and emotions. These drugs come in many types, including selective serotonin reuptake inhibitors, SSRIs, and serotonin and norepinephrine reuptake inhibitors, SNRIs. Medications can be highly effective, but can also come with potential side effects. It's important to discuss these risks and benefits with your doctor. Alongside medication and therapy, certain lifestyle changes can play a role in managing depression symptoms. Regular physical activity, a healthy diet, adequate sleep, reducing alcohol, and avoiding drugs all can have significant effects on mood and energy levels. In cases where medication and therapy aren't effective, brain stimulation therapies may be an option. This includes treatments such as electroconvulsive therapy, ECT, and newer forms of stimulation like repetitive transcranial magnetic stimulation, TMS. These are considered more advanced treatment options and are typically reserved for cases of severe depression. Depression is an invisible illness. It doesn't show up on an X-ray or a blood test, but it's just as real and just as devastating as any physical ailment. Society's understanding and acceptance of mental illness have come a long way, but there's still a lot of work to be done. The stigma associated with mental health can prevent individuals from seeking help, and that's why conversations like these are so vital. By understanding more about depression, its symptoms, causes, and treatments, we can support those living with depression and play our part in challenging the misconceptions surrounding this mental health condition. Remember, it's okay not to be okay, and reaching out for help is a sign of strength, not weakness. If you or someone you know is suffering from depression, don't hesitate to seek professional help. Thank you for taking the time to learn more about depression. With understanding and empathy, we can contribute to a world that supports mental health and wellness for everyone.